There was a time, not so long ago, when my mind felt like a safe haven. I used to trust my thoughts implicitly, relying on them to guide me through life's complexities. They were my compass and the unwavering voice of reason in a chaotic world. Every decision and action were filtered through the lens of my own internal monologue, and I had no reason to doubt its accuracy. But then slowly, everything began to change. The familiar corners of my mind started to warp. The thoughts that once offered peace and direction became distorted, unreliable, even malevolent. They started whispering doubts and fears, painting vivid pictures of worst-case scenarios. I couldn't see the line between reality and fiction, and I found myself trapped in a vice of my own making, unable to connect to my own reality. It was a terrifying descent into the unknown, a battle against the enemy within. My name is Sam, and this is my personal story about Seroquel, a medication that became a pivotal part of my journey back from the brink. My story of struggle, resilience, and ultimately, hope. It's about confronting the darkness within and finding a path towards healing and self-discovery. The medication that helped me find my way back to myself, reclaim my mind, and rediscover the peace and clarity that had been stolen away. I share my story with the hope that it might offer solace and guidance to others that are suffering. Seroquel saved me from myself. Quetiapine, or more commonly known as Seroquel, is an atypical antipsychotic drug FDA approved for schizophrenia, bipolar disorder, mania associated with bipolar I disorder, and major depression when other treatments aren't enough. Seroquel works by affecting the balance of certain chemicals in the brain, helping to stabilize mood and reduce symptoms of psychosis. It's often considered a second-line treatment, reserved for cases where other medications have proven ineffective. The goal is to restore a sense of normalcy and improve overall functioning, allowing individuals to lead more fulfilling lives. A stigma surrounding mental health often causes those struggling to not seek treatment. Seroquel is a powerful tool in the fight against mental illness, offering hope and relief to those who have struggled far too long. Side effects include weight gain, drowsiness, dystonia, QT prolongation, EPS, TD, cardiovascular disease, insomnia, agitation, anxiety, abdominal pain, rhabdomyolysis, dry mouth, and Stevens-Johnson syndrome. This medication can be safely consumed by adolescents 13 years and older, adults, and geriatric patients. The starting dose should be 25 milligrams and may require dosage adjustments by the prescriber. Geriatric patients with dementia-related psychosis and children younger than 13 years old should not take this medication. There's a black box warning about increased risk of suicidal thoughts and behaviors in young adults. This warning is a serious reminder of the potential risks associated with Seroquel and other antidepressant medications. It's crucial for young adults and their families to be aware of this risk and to monitor closely for any changes in mood or behavior. The black box warning serves as a call to action, urging caution and vigilance in the treatment of mental health conditions in young adults. Contraindications for this medication are persons with hypersensitivity, breastfeeding, and geriatric patients with dementia-related psychosis. Always tell your provider about every medication you're taking, because Seroquel can interact with other drugs. Possible interactions include, but are not limited to, Cispride, Multac, metoclopramide, Pimozide, Thioridazine, Atropine, Avacimeab, Rifampin, St. John's wort, as well as alcohol and grapefruit. It's essential to provide your doctor with an accurate list of all medications, including over-the-counter drugs, supplements, and herbal remedies. This information will help to assess the potential risks and make informed decisions about your treatment plan. It took time, but Seroquel gave me back control over my thoughts. The medication helped to stabilize my mood and reduce my symptoms, allowing me to think more clearly and make better decisions. I slowly began to regain a sense of normalcy and control over my life. Seroquel was a valuable tool in my recovery, but it was also essential to combine lifestyle changes and a strong support system. The journey to mental wellness is a marathon, not a sprint, and it requires patience, perseverance, and above all, commitment to self-care. Talk to your healthcare provider. They can provide personalized care, helping you navigate the complexities of mental health treatment. Don't hesitate to reach out and seek help if you're struggling with mental health issues. Your provider can assess your condition, recommend appropriate treatments, and monitor your progress. They are your partners in your journey to mental wellness, and their expertise and support can make a significant difference in your life. Remember, you're not alone and help is available. This is not medical advice. Only your healthcare provider can determine if Seroquel is right for you. The information provided here is for educational purposes only and should not be considered a substitute for professional medical advice. Always consult with your doctor or other qualified healthcare providers before making decisions about your treatment plan. They can assess your individual needs and circumstances and provide you with the most appropriate and effective care. Your health is your most valuable asset, so prioritize it and seek professional guidance when needed. Recommit yourself to health, life, and happiness by scheduling an appointment and starting Seroquel today.